Hello, I'm Ryota Sagami from Japan. My affiliation is Department of Gastroenterology, Oita Sangai Medical Center, and Department of Gastroenterology, Faculty of Medicine, Oita University. In addition, I belong to Pancreatic Cancer Research for Secure Salvage Young Investigators, PASSION. PASSION is a study group composed of young investigators who research early pancreatic cancer diagnosis and treatment. That was established in January 2021. We hold online meeting about once a month and discuss about the case presentation of early pancreatic cancer. PASSION has now over 50 members of Japanese endoscopists, radiologists, cytologists, and pathologists. In addition, we have constructed new evidences about early pancreatic cancer diagnosis. The accepted article through diagnostic ability of endoscopic ultrasound-guided fine needle aspiration biopsy for small pancreatic cancer 10 mm or less, and salvage diagnosis by pancreatic juice cytology, a multicenter study, is the third article from PASSION management members. Pancreatic ductal adenocarcinoma (PDAC) is associated with a poor prognosis and an overall 5-year survival rate of 11%. Conversely, patients with invasive PDAC 10 mm or less have a 5-year survival rate of over 80%. Thus, the actual diagnosis of PDAC 10 mm would improve the prognosis of PDAC patients. Endoscopic ultrasound EUS has made it possible to visualize small pancreatic solid lesions, including PDAC. Preoperative histological diagnosis of this small pancreatic lesion is critical. EUS-guided fine needle aspiration biopsy (EUS-FNAB) it has high sensitivity, specificity, and accuracy of over 90%. By contrast, the sensitivity of EUS-FNAB for the diagnosis of pancreatic lesion 10 mm or less is reported to be relatively low at 33 to 80%. Especially, sensitivity is extremely low only for PDAC 10 mm. In addition, technical failures of EUS-FNAB can be attributed to the anatomical inaccessibility or unclear visibility of the tumor. Pancreatic juice cytology (PJC) has recently gained research attention owing to its high preoperative diagnostic ability for small PDAC and may be a salvage diagnostic method for cases that are difficult to diagnose using EUS-FNAB. PJC method has been used for the diagnosis of PDAC typically in Japan from long before appearance of EUS-FNAB. However, it may be not typical in Western countries. The appropriateness of EUS-FNAB and PJC remains controversial. We consider that the diagnostic success rate of EUS-FNAB for PDAC 10 mm is relatively low than that for larger pancreatic tumors, and PJC may compensate for this deficiency. This large cohort multicenter study aimed to evaluate the diagnostic ability of EUS-FNAB for PDAC 10 mm and the salvage ability of PJC to diagnose PDAC 10 mm or less cases not detected using EUS-FNAB. Among about 5,000 patients diagnosed with pancreatic tumors of all sizes who underwent attempted EUS-FNAB for cytohistological diagnosis, EUS-FNAB procedures were attempted for 271 patients with pancreatic tumors 10 mm or less in diameter. Finally, 86 of the 271, 32% patients were diagnosed with PDAC. Overall, 81% of patients with pancreatic tumors archived technically successful EUS-FNAB. The sensitivity, specificity, and accuracy of EUS-FNAB cytohistological examination were 82%, 95%, and 91% respectively. In the comparison of diagnostic ability using area and cap, EUS-FNAB cytohistological examination had a higher diagnostic ability than EUS-FNAB cytological examination alone or EUS-FNAB histological examination alone. Finally, 35 patients were diagnosed with PDAC 10 mm or less from among the 212 patients who encountered technical failure negative result by EUS-FNAB. Among these 35 patients finally diagnosed with PDAC 10 mm, 74% were correctly diagnosed by additional salvage PGC with accuracy of 82%. The adverse event rate of EUS-FNAB and PGC was 2 and 4% respectively. They were all mild or moderate cases that improved with conservative treatment. Target not being PDAC and use of a 25 gauge needle was significant factors positively affecting diagnostic accuracy. These factors were evaluated using multivariate logistic analysis, with the non-existence of PDAC being the most significant factor contributing to accurate diagnosis. The actual technical success rate and sensitivity of EUS-FNAB for diagnosing of PDAC 10 mm were relatively low compared to those reported the pancreatic cancer in general. PGC may help to salvage cases with technical failure or EUS-FNAB associated false negative diagnosis. When EUS-FNAB for pancreatic region 10 mm strongly suspected to be PDAC is technically unsuccessful or yields negative results. An additional assessment via PGC as a salvage diagnostic tool is recommended. Patient group will construct new evidence about our pancreatic cancer diagnosis continuously, especially pancreatic juice cytology, and roll the method over the world from Japan. Thank you.